We take a look at some health headlines this weekend involving popular drugs used for weight loss. Joining us is ABC's medical correspondent, Dr. Darien Sutton. Dr. Darien, good morning to you.
Good morning.
So we've been talking about these weight loss drugs, but now there's a new study about the potential use for people suffering from sleep apnea. What can you tell us about that?
So this is a new study that finds and looks at the medication tirzepatide. That's the active ingredient in Zepbound, the newest injectable medication for weight loss, and it found to be beneficial with people with sleep apnea. Now, sleep apnea, just to be clear, is a lot more than just a loud snoring. Sleep apnea is when you stop breathing while you're sleeping. This increases one's risk of heart disease, high blood pressure, dementia, and early death. So in this study, it found that patients who used tirzepatide had significant reductions in sleep apnea, approximately 60% in the number of sleep apnea events. And what even more incredibly interesting in this is that nearly 50% of participants had reduced symptoms enough where their overall disorder was resolved. So these findings are really significant.
Yeah, I mean, sleep apnea can be really debilitating for a lot of people.
Incredibly.
So what are the next steps in getting FDA approval?
So Eli Lilly, the creator of Zepbound, has submitted these results to the FDA. We might see a response as early as next year, but many are skeptical, mainly because there needs to be more data to understand what is a true association here. And obviously, we need more data to make sure that this can be replicated, which is an important finding in science.
Okay, and another thing that we're learning now, the World Health Organization is warning about counterfeit Ozempic and other drugs. What do we need to know?
So this is incredibly important. So fake batches of Ozempic or semaglutide, the active ingredient in Ozempic, were found in UK, US, and Brazil. And in these findings, they found that in some cases, the active ingredient was replaced with things like insulin, which can be incredibly lethal if given inappropriately. In other cases, the needles, a part of these products, were found to be counterfeit, which brings into question whether or not they were sterile. And then in some cases, the traces of heavy metals were found in these products. So you have to be extremely cautious when you're using these.
You can see why people might try to find other ways to get them, though. They're so expensive. So you have to be careful. And it's not just Ozempic, but other drugs as well. So how do you tell the difference between the real thing and the fakes?
Well, I think, number one, paying attention to your product. When you get it, if you notice spelling errors or things that don't make sense, you should be extremely cautious. Also, make sure that you're getting it from a licensed pharmacy. Many don't know, but the licenses of pharmacies are publicly available. So if you search State Board of Pharmacy, you can find them just to make sure. And then, of course, be wary of any deep discount.
You've also told us before, we don't have much time left, but that you can talk to your pharmacist if you're looking for like an alternative, right? There are options.
Yep, and you can transfer your electronic prescriptions without a doctor in case you're trying to find the prescription that you need.
Okay, excellent. Dr. Darien, we always appreciate it. Thank you so much.